Hello, my name is Andrew Stringfield, and I'm a nursing student at IU East, and today I'm going to talk about the COVID-19 coronavirus. Today we're going to talk about the pathophysiology and what it all entitles and why it affects your respiratory system. For example, the COVID-19 virus is a positive stranded RNA virus. So it's pretty much like a another form of pneumonia, both out the same symptoms, but it says it's also part of like a SARS. It's connected to that in some way. So it affects your respiratory system, causes symptoms such as dyspnea and fever, and among other things. Um, so, possible complications and how would we treat these complications? Well, possible complications could be, of course, shortness of breath. You are unable to fight off the infection with some people who are older, which would mean that you have an immunocompromised system, and it's hard to fight off that system, which could lead to possible, fatality. How can we treat these? Well, you can treat them such as treating the symptoms. So you would treat the dyspnea, the shortness of breath, the output of oxygen. You want to make sure they have enough, they're able to breathe adequately, and you want to make sure they're on fluids and make sure they are taking any type of decongestants. They want to help with the symptoms. Also, rest is also a big treatment form. Just resting, sleeping it all off, helping your body fight off the infection. So is it contagious? And we want to discuss measures in preventing this. So yes, it is very contagious. It has been confirmed that it is droplet, which means that you can get it breathing in the same, if somebody else breathes in front of you or coughs in front of you, you can breathe that in, but a simple surgical mask can protect that. So to protect yourself, I would try to stay home as best you can. That's number one. Avoid contact, avoid large groups, avoid places that are like high flow, high traffic areas. Should the client go to work? Yes and no. It just depends on where you work. Like if you work in a hospital, you should probably go to work. It helps treat the patients, and of course the grocery store should stay open because it helps feed the entire United States. So they should definitely stay open too, but should be limited to about how many people should be entering, because if there's more people, more chance of everybody catching it. So yes, coughing and sneezing, you want to make sure you cover your mouth. You want to make sure if you see someone coughing, avoid them. I mean, and not be that, but just for the safety, just avoid them for the time being. Just make sure you wear that surgical mask, and you'll be okay. And avoid high traffic areas. So common treatments for coronavirus could be like decongestants, antitussives, which helps with coughing and the sneezing could be helping with the decongestants, help with that. And then of course you want to take your ibuprofen, your Tylenol to help with that fever, because it usually spikes around 102, 103 degrees, and it usually is hard to break. Just make sure you're monitoring your fever, not getting, too hyperthermic. So different age groups can be affected. Elderly, for example, can be affected more because they already some can have a lot of health problems to begin with, and with that making their immune system compromised already, this pathogen can really do some damage. If your body's already fighting, let's say, an infection, or already working hard to keep your heart going, this can make make your heart strained, and it can really take a number on the elderly and kids, of course, too. They're already immunocompromised, like at birth or early age. They can fight off an infection. It can be really hard for them too. So potential complications could be, of course, the dyspnea. You're not getting enough oxygen to support hypoxia, and hypoxemia could be number one complication from it. Not get enough oxygen to support your heart or your tissues. And they can be treated. Well, you can be treated by helping the dyspnea, make sure you get enough oxygen. So applying oxygen would be best. And
Can I go to song? The song.
so is it possible that oxygen is required as part of treatment or to support during your assigned respiratory illness? So yes, oxygen can help with treatment because it helps you with breathing issues. If you're having trouble breathing and not getting enough oxygen in, then this can really help your system, help you, combat that dyspnea, and you'll be able to breathe a lot better. Helps your